limited amount of time, so I didn't bring any slides, but then I've gotten here and I've learned that I might have some extra time, so that's a good thing. But I can most certainly forward some presentation so you guys can add it to your notebook. I will forward that, and then they can email it out to everybody or give it to you when you come back next month, I guess. So I am a Child Protective Services supervisor with the Wycomico County Department of Social Services. I also supervise our intake screening unit. Our Child Advocacy Center has 2 CPS supervisors because we're a little bit larger. We have 10 investigators. We're a full functioning Child Advocacy Center. We have the 10 CPS investigators or 10 CPS workers. We're trying to move away from them being quad investigators. We have 3 law enforcement detectives and a law enforcement supervisor. We have 2 therapists from Life Crisis, and we also have a family advocate that helps all of our families through the court process if they're going through the court process. And we have a doctor who's not on site full time, but most certainly we have a medical suite in our new Child Advocacy Center, and that's where she does her exam for the children who have been traumatized by sexual abuse. And so we are getting ready to move, hopefully within the next 8 weeks, to the new Child Advocacy Center, which is on Main Street. Right there, I don't know how many of you go downtown, but there's a building down there where it was the First Mariners Bank, and it's got a red front now, and you can see stuff going on. The state's attorney's office is upstairs. They're already inside, and we're waiting for cubicles and furniture, and when that is in, the Child Advocacy Center will then move there. So we're pretty excited about that. So they've asked me to come talk to you about child abuse and neglect and what the definitions are and about reporting, because probably most of you, if not all of you in here, are mandated reporters. So the one thing to remember with anything that we deal with, the person has to be, the maltreater has to be a family member, a household member, or a caregiver of some sort, whether that's in the school setting, on the bus, in a daycare, anything like that. So, but with child abuse, physical abuse, there has to be some type of injury, and it can be visible, and it doesn't have to be visible. Some of the internal injuries aren't always visible, but there has to be some type of injury. It has to be caused by a parent, caretaker, household member, and it has to show that the child has been harmed or at substantial risk of harm. Child neglect is when there is the omission, there's a lack of proper care and attention. It can be about leaving the child unattended. It can be significant hygiene issues. It can be, the housing conditions are unsafe. And so that's the majority of our calls is related to child neglect. And sometimes, all the time it has to be a caregiver that is the alleged maltreater. In Maryland, what the law says is that any child under the age of 8 has to be with somebody who's at least 13. So you can't leave a child under the age of 8 home alone. You can't leave them in the car by themselves, and they have to be with someone who's at least 13. And then you've got that gray area in between, which is 8 to 12, where they can be left home alone. They can't babysit, but you then have to look at how long it is. And that's why I call it the gray area. There's no, specific criteria about how long, or what the child has to do when they're home alone, and what their responsibilities are. So when we get those calls, we're looking at how long it was, what the child was responsible for. Did he have to cook and cook for himself or fix his own meals, get up by himself, get to school by themselves, and what's the maturity level of the child. So we look at all that and tie that in together. There's certain, 8-year-olds that can probably be home alone for an hour, and then there's other 8-year-olds that you wouldn't want home alone at all. And so we look at all that. And then, of course, there's sexual abuse, and that is any time that there's been any type of sexual act upon a child, exposure of any type of sexual act, pornographic material by a caretaker, household member, or family member. And so right now with Wycomico County DSS, we get an average of 160 CPS calls a month, and we accept right about 50% of those. And those are accepted historically for a Child Protective Services investigation. And what that means is it's assigned. If it's a serious physical abuse or a sexual abuse, it gets assigned to a team, which is a Child Protective Services investigator, Child Protective Services worker, and a law enforcement detective. The goal of investigation is to find out what happened, who caused it, or who's responsible for the neglect, and how did it happen. And historically, we've been about going out, finding that information out, finding out whether the family needs ongoing services, and then closing our case. What has changed in the state of Maryland is alternative response. And I know that the DSS employees that are in here have heard about alternative response, and I know that people who attend multidisciplinary team meetings have heard about it. And you may have even seen myself or one of my counterparts come to your agency and talk about alternative response. I am very excited about alternative response, and since I have a little bit extra time, I am going to talk about it. It is still part of Child Protective Services. So envision, you've got the umbrella of Child Protective Services. And then you have two responses. You have an investigative response, which is what I just got done talking about. That's our traditional response, where we're going out and finding out the who, what, where, when. And then you've got alternative response. And the SURE has been doing alternative response since April 1st. Our 1-month anniversary was yesterday. The entire state, all of the state, will be doing alternative response by July 1st of this year. The last phase is Baltimore City. They are phase number 5. There have been 5 phases. The SURE, all of the SURE, lower and upper, were phase 4. And then there's been other jurisdictions across the state that have been going live since July 1st of last year. And so we've been doing it since April. And what we are finding is about 40 to 50% of the referrals that we accept. So the referrals that we accept for a Child Protective Services response, about 40 to 50% of those have been going to the alternative response track, and then the other half have been going to the traditional investigative response. Alternative response is no longer about going out and finding out the who, what, where, when. It's no longer about, doing unannounced home visits and finding, just how the family's living. Oh, I got to do an unannounced visit because I want to see how they're really living. Because if they know I'm coming, they're going to tidy up, clean up, do whatever. I want to catch them, see how they're really living. It's no longer about that. It's not really about going to the school and interviewing the child first. It is about working with the family as a whole, meeting with them together, and finding out what their strengths are and working with those strengths to help them resolve the issues that brought them to the attention of the department in the first place. And so we are, moving away from going out to the schools, interviewing the children, and then making contact with the parents. We are all about calling the parents first, and if we can't get a hold of them, at least making a home visit first and seeing all of them there together. Whether you can prove something happened or not, we know these families have issues. What is the purpose of just identifying them as a maltreater or a neglector and then moving on? Because when you do that, you get in the mindset of investigation, finding out what happened and moving on. And what has happened is that workers aren't really digging into what's really the underlying issues. They become, we hire investigators that are social workers, but then we have not been using their social work skills. If we wanted investigators, we could hire, criminal justice, we could hire all kinds of different, backgrounds, but we have historically, we're looking for social workers, we're looking for licensed social workers, we're looking for MSWs, but then we're not using those social work skills. So this new response allows us to use those skills and really dig in and do a thorough assessment about what works well, what are the concerns, and then how do we resolve them? How do we resolve them so that you don't come back to our attention, that you don't have an investigation in the future? And so families, we're hoping, will be more open to working with us, will be more open to engaging with us. and we'll see that we're not just there to make a finding, we're not just there to take their children, we're not just there to judge them and label them. And so far, things seem to be going well. We are not the first state to do this. There's research out there that it is effective in the other states it's been working in. There's lots of research that's been done in Minnesota and either Ohio or Iowa. I'm at a blank for which state. But those two states particularly have been doing it for a while, and there is research out there that shows that the work that they're doing is effective. And so change is hard for people, and so we're getting the social workers, the workers used to the idea and the concept, and they're buying into it, and it's a good thing. And so, it truly goes along with family center practice that you've heard about the department doing for the past 6 or 7 years. Family center practice, we probably have been invited to a family involvement meeting where, we're really working with the family. There are, resources, who's involved with them. We're bringing uncles, aunts, grandparents to the table, and we're using them as resources. Doesn't mean it has to be a placement resource, but it means that maybe they can get the child to their appointments, or maybe they can, check in on the family every, once a week or every few days. And so we're finding that that's been very effective. It's helped keep children safe. It's helped keep them out of care. It's proven that just because we didn't bring them into care doesn't mean we can't keep them safe. And so alternative response really just builds into family center practice. Yes, ma'am.
It sounds to me like this really dovetails into what we wanted to do with this workshop, is looking at that long-term response for kids in foster care. So it sounds like what we're doing here is right on target for what you're doing.
Sure, because it is about using the different resources, and we are inviting therapists and addictions workers, and Core Service Agency has been to a FEM, and so and they can be an hour, they can be 2 hours. We do them with all the children in foster care, and so foster care is very used to them, and so they definitely are effective, and it is about the community coming together and helping these families. Sure, absolutely. And so then, and so what does that mean what does alternative response mean for mandated reporters? Well, nothing changes as far as what your mandates are. You're still required to report anything that you suspect to be child abuse or neglect. You won't find out if it's been accepted, period. We don't share that. We're not allowed to. But then even if it's accepted, you don't find out whether it's alternative response or investigative response. What may change for you, and what I'm hoping will change for you, and what I'm working on, is when you call in to make a report, the workers, usually just say, okay, tell us what you know, tell us what the injury looks like, tell us what the child told you. Bam, we're done. And what we are hoping that the intake workers can move into, and like I said, what I'm working with them on, is asking you more questions, gathering more information when you make that phone call. So just kind of keep that in mind, so that when you're calling, in your mind, you know who their resources are, how long have you worked with them, and when, if you've been working with them for years and things were good at one point in time, what was it that made it good? Who does this child talk about that is a resource to them? Do they have a favorite teacher? Do they have a favorite family member? Is there somebody that they go visit on a regular basis? And so being able to tell us that information so that we know what to work with is really going to be imperative. We really want our intake workers to be the first point of contact, but we want them doing a good assessment. We want them to start the assessment process. And so that might be a difference with what you see. So as far as mandated reporting, anytime you suspect child abuse or neglect, anytime a child has disclosed something to you, you know that you're a mandated reporter and you're required to call the local department. Whatever jurisdiction it occurred in is where it should be called into. If you're not sure and you want to call the county in which you live, that is fine. We can either tell you where you need to call, or we can relay that information for you. We are willing to do that, whether or not it's another state, another jurisdiction. We're okay with doing that, but we will give you the option in the beginning to call the correct county or jurisdiction. Yes,
Me
ma'am.
again.
Yes.
What about one child abusing another child? Where does that fall?
Right. What we look at is, and I assume you're talking about like sexual abuse.
Mm-hmm.
Okay.
General. Yeah.
What we look at usually is the age of the children and what is occurring. And so, is it really abusing another child, or are the children acting out something they've seen, or is it natural exploration, or is one child maybe coercing the child or forcing the child? And I don't know if I said this, but what are the ages of the children? How much of a gap is there? We take all of it very serious, but whether or not it meets the criteria of abuse is different. And so if we believe that it meets the criteria of abuse, then we will open it as a sexual abuse. But what we don't want to do is, identify, a young child, whether it's female or male, as an alleged abuser, if we don't need to. I mean, sure, that child needs help, but do they really need something on their record for the next 25 years where they can't maybe get a job in the school system or a daycare setting or whatever? Anybody that would do a child protective services clearance when they went to go for employment in 15 years. And so that's what we kind of take in consideration as well. But even if it doesn't meet the criteria for sex abuse where a team is assigned, then we open it as what we call an ROA, which is request of another agency, and that's our go-to for being able to still interview children, and that can include forensic interviews because we do forensic interviews at the department, and whether or not we want to find out why they're acting out, and perhaps we get a disclosure that something's happened to the child in a previous situation, and so then maybe we open up an ROA and we're assessing and we're interviewing, and we find out that one of the children was abused, 2 years ago, but they never made the disclosure. But here they are in this environment, the safe environment where they're being interviewed by, a forensic interviewer, and they make a disclosure, and then, we can address it from there. But, working with the parents to help them understand, to tell them about the resources in the community, about mental health services that are available, about trauma-based therapy that's available. And so we don't ignore any of them. We always look into it, whether it's on the track of sexual abuse or on the track of an ROA. Something like that would never be alternative response. All of our sexual abuse are alternative response, and all of our serious physical abuses, critical incidents, are an investigative response. Your alternative response is your low-level people who haven't been to the attention, who haven't been indicated in the past. Those are the ones that go to, even if it's a minor injury, even if it's a neglectful situation, we're going out and addressing it under alternative response. But our sex abuses are investigative response or an ROA. It would never be an alternative response unless it still met the criteria for CPS. And if they are, young siblings, maybe just kind of acting out, that would be an ROA. But we take all of those serious because we want to find out why the child or children are acting out. Where do they learn this from? Maybe they've seen something they shouldn't see. Maybe the parent's unaware that the child's peeking in on them in the middle of the night, or maybe they don't realize that their, videos and magazines are accessible to these children. And so, educating them like, this is not appropriate. You need, we get all kinds of things. Last week got, the little, 5-year-old are taking the, her mom's vibrator to grandma's house. Why does she have access to it? So maybe that's not sex abuse, but yeah, we need to address that. And so we're going out and we're talking to them about it. So you just never know what you got. And let me tell you, you guys from DSS know you can't make the stuff up that we hear. When you're not sure about what to report, just call us. Don't hesitate. We get very busy and overwhelmed over there, but we don't ever decline a call. We may say, well, I'm not really sure that, we educate. and um, do what we can to help you understand what's appropriate. But we don't ever turn you away. We may screen out and we say, well, you know what, that probably doesn't meet our criteria, and their go-to is, I'm gonna forward this to my supervisor. That's their go-to. I am this complete, what am I looking for, scapegoat for them over there. They're like, yep, you want to talk to my supervisor? Yep, she's not available right now, but she'll call you back. So, but they always tell you that they will pass it on to their supervisor. But I have a great screening intake unit who actually screens most of our calls and whatnot. Yes, sir.
Yeah, in terms of like referrals and kids being safe to go back to school or maintain in their environment, who really does that, and how do you guys do referrals out once you finish your investigation?
When there's, I'm sorry.
Once your investigation is done and you determine that kid may need treatment, how does that work? How does the referral process work, and where do you refer to?
Well, it depends. Well, whether or not it's an investigative response or an alternative response, we're going out and we're addressing the issues.
Right.
And if we've got safety concerns, then we can always do what we call a safety plan and put different things in place. And we never close the case when there's an instant safety plan. If we have 60 days to complete our investigation, and if we can't resolve the issues in 60 days, then we can always send them to in-home services within the department. But we also educate parents about the resources that are available in the community. We might have a family involvement meeting and pull the different family members together and come up with a plan, a written plan that everybody gets a copy of, as to how, what's going to happen next, whether in-home services is going to be in place or they're going to be linked up to mental health, and that sort of thing. If the parent needs treatment and they need to go away, where's the child going to be? We offer respite services with our licensed foster care homes to help families out if they've got a situation that they need to work on. A lot of times we realize that problems can be so significant that they need to concentrate on getting themselves better, and we can help them keep their child safe, but they don't lose custody or anything like that. So we use respite homes, or the people who have come to the table, the family resources, we use them. And so I'm not sure. Am I answering your question?
Well, I'm thinking more in terms of the specific like treatment for sex offending behaviors or whatever behaviors are popping up. Do you address those behaviors?
Well, if it's a perpetrator who has sexually offended, then you've got law enforcement involved and you've got the courts involved. And so then usually what happens is they're court ordered to do certain things,
right,
and
right.
They get referred to a sex offender treatment program. And so I trust in those programs, and I trust that the courts will do what they need to do. People's fate is in their hands. If you don't do what you're supposed to do, then there's consequences to that. And so if you don't, a lot of people want to do what they're supposed to do to avoid time. And so there's follow up, whether it's through us, the court. We refer them to in-home services and they monitor that. Sometimes they have to go through probation. We can't monitor all of it, but there's programs out there that can, and that's what we refer to.
Because I was thinking we're dealing with a wide range of ages for the children, once they probably get involved in the behavior because of exposure in the environment,
Sure.
It has to be certain degree of education to really kind of put the facts out there and make sure we support the kids.
Right. Absolutely, and if it's a child that doesn't necessarily go through DJS, because we do work with DJS too, and the child has perpetrated and there needs to be some type of action taken such as that, we definitely get DJS involved, or the police do. And then so they go down that track. But if perhaps they're just kind of sexually acting out, and we realize that they need to be linked, and we're not sure that the parent's going to follow through, then those are the cases that we send to in-home, and then that case manager, that social worker, can help assure that the child gets to those appointments and gets the help that they need, whether that looks like transportation or just giving them a calendar so they can make sure that they make those appointments, and then getting the consent, so there's conversations back and forth between those workers and the
can I jump in, Lori? You have in your binders, you have this little pamphlet. You can also go to Tony Kavanaugh Johnson's website. She has another little booklet, what's sexual behavior in children, what's healthy and what's not. It's a valuable little booklet. And so we have this one for you to use. I think if you have children that come in, no matter what agency they come in, if they come in with sexual behavior problems, I guess one of the things I wanted to emphasize is it is a specialty area. And if you're going to take that on yourself, whether you're a therapist or from social services, you do need to educate yourself about what's normal and what may need education or what may really need treatment. And so that's why I've given you this resource. And I encourage you, if you get children with sexual behavior problems, she is the expert. She is the #1 expert. So go to her website. And there's also Safer Society Press for other materials. So I just wanted to let them know that we've given them some resources to look at that.
You said what was that? A second resource after
Safer Society Press. And I think you just Google that. So those are the two main resources for materials to work with children with sexual behavior problems. When children have sexual behavior problems, you do have to be able to address those directly. You cannot ignore them because they won't get better. And you can't do regular therapy and expect them to get better. So you have to address those directly. Wonderful job.
So I kind of gave you the overview. It was quick. Most of you have probably heard it before. But do you have any questions of me that I can answer before I go? I did that great? You did that great.
Yeah.
All right. You did wonderful. All right. Thank you.
We have our next speakers are here, right, Heather? Switch the computers out. So do you want to take a little 5-10 minute break while we switch computers, and we'll start up again in 10 minutes? Does that work? Okay. Thank you very much.